Okay, ready for me to start? All right, well then I'll welcome everybody and thank you for joining us today. I want to especially begin by thanking Commissioner Terry Allen, Dr. Heidi Gullett, and Ramona Brazil, who are with the Board of Health for Cuyahoga County and doing just a fabulous job. It's really been my pleasure to work with them closely and to see their commitment to saving lives and keeping people healthy in Cuyahoga County. So thank you all. I wish I could say that overall here we're moving in a good direction with our COVID-19 cases, but it seems that's not the case. Our positive cases are still way up over the last month. While I'm glad that we've moved off the quote watch list for turning from red to purple under the governor's standards, but we're still deep red, and that's bad. I feel as if I'm repeating myself when I mention masks every week, but I do it because it's just so important. Our Board of Health experts, as well as the CDC and other prominent health organizations, are telling residents that wearing masks saves lives, your own as well as others. Nothing about this has changed. And with the governor's order put into place on July 8th, face masks are now mandatory in public spaces in red counties such as ours. We set up a phone line for people to call with compliance feedback, questions, and concerns. The number is 216-698-5050. The primary purpose is to bring greater community awareness to the importance of wearing a mask. And for that, it does seem to be working. From last Friday till Wednesday, we received over 1,400 calls and form submissions about people not wearing masks. While there's not yet enough data to form definitive conclusions, the locations seem to be focused on several shopping malls, big retail and grocery stores, and gas stations. We've created a map showing where submissions are located so far. We've turned the data over to the Cuyahoga County and Cleveland Boards of Health, and we're in the process of notifying the local cities as well. Are we showing the map? On my screen, I don't see it, okay? Map's up. As I said, after the governor announced the mask mandate for Cuyahoga and other counties, our intent is not, and I underline not, to punish people for failing to wear a mask. We just want people to understand that wearing a mask helps keep us all safe. So please, please wear a mask. Now I'd like to switch gears and talk about how the COVID pandemic is affecting our kids. Children are seeing the effects of this pandemic in big ways. They don't know if they'll be going back to school in the fall, when they might see their friends again, or when they can play during recess again. And if the governor or individual school districts decide not to have kids go back to school in person this fall, this doesn't mean children aren't expected to learn. This learning would then take place online. But here's the problem. Almost 25% of families in Cuyahoga County lack internet access and computers. So the potential for students being left behind, especially in low-income families, is terrible. We've recognized and been working on this problem actually for years, but the COVID crisis has brought it front and center. In the spring, when COVID first closed down schools, we worked with CMSD to provide 300 hotspots with internet service. We also made a call out to businesses and community partners to provide donations for computer equipment that could be used for the community. And you all came through, donating 2,000 computers to PCs for People. But that was just a start to what's needed in the community. I've introduced legislation to council for the county to partner with the Cleveland Foundation and the Gun Foundation to create the Greater Cleveland Digital Equity Fund, which will be used to address the digital divide throughout Greater Cleveland. This digital equity fund will address both the immediate and long-term needs surrounding broadband access, computers, and other tech devices, digital literacy, and tech support. I'm recommending to council that the county put in $1.5 million to the Digital Equity Fund, adding the commitments by the Cleveland and Gun Foundations. The fund will have $4 million in commitments that'll directly impact these efforts and help lessen the digital divide. The first project that'll be supported by the Digital Equity Fund will be to partner with T-Mobile to provide 7,500 unlimited data hotspots to families with a K-12 student in public or partner charter schools in Cuyahoga County. T-Mobile has committed $1 million in equipment donations to this project as part of its Empower ED initiative, and that's in addition to the $4 million fund. Internet access is only one part of the digital divide. You can't access the internet without a device. Our phones continue to get smarter, but for schoolwork, you really need access to a computer or tablet. That's why we'll be providing up to 10,000 computers from local organizations such as PCs for People and RET3. You know, we've all been talking about social justice and the need to eliminate structural racism. If minority children can't learn because they're without access to the internet, if adults can't look for open jobs or put together a resume because they can't get on the internet, if people can't check out or obtain quality health care because they can't access the internet, then we'll never succeed at eliminating structural racism. That's why Cuyahoga County is a leading member in the Digital Equity Coalition, a comprehensive effort to keep public, private, nonprofit, and philanthropic partners engaged with the overall strategy to address digital inequities. We all know the problem of digital inclusion. Now is the time to start moving to solve the problem as a community. As additional partners join this coalition and more dollars are committed to the fund, we hope to expand our efforts beyond children to other populations that struggle with access, such as underemployed adults and senior citizens, just to name some. And you can help. We need your help. Back in April, I put a call out for businesses and residents to consider donating computers and other equipment that could then be given out to those who need it. When we made that call out, PCs for People received over 2,000 donations. That was incredible, truly incredible. And I'm grateful for your generous donations. We know that there's more that can be done, though. So I'm asking again, for those businesses or residents who have computers, keyboards, mice, monitors, anything that's not being used, please consider donating them for a family in need. Many businesses have computer equipment that needs recycling. By donating laptops, computers, tablets, and other computer accessories, you know that the equipment is going to go to someone who really needs it. PCs for People does free pickup if you're able to donate 10 or more computers. PCs for People is also doing an individual drop-off week next week, Monday through Friday and Saturday, 9 a.m. to 12 p.m. at 3126 St. Clair Avenue. That's 3126 St. Clair Avenue in Cleveland. The focus for individuals is on laptops with a webcam, if possible, but they'll also accept desktops and peripherals like mice and keyboards and the related items. And the computers, by the way, can be old or broken. PCs for People can refurbish them and will refurbish them for the people that need them. If you need more information, you can call 216-600-0014, or you can email cleveland@pcsforpeople.org. There are so many incredible partners to thank for their contributions. The Cleveland Foundation and the Gun Foundation and T-Mobile for partnering in the creation of the fund. And this first project for kids is really thanks to them. Also, the Cleveland Innovation Project, CMSD, the Cleveland and Cuyahoga County Public Libraries, the Greater Cleveland Partnership, Ohio Means Jobs, and many, many more are contributing their insights to the Digital Equity Coalition. Your expertise and passion for this project is what helps push an idea like this into a tangible product. I'd also like to thank County Council for their continued support, and Catherine Tkachuk, our Chief Innovation and Performance Officer at the county, who's been our lead on this initiative. Thank you all very much. Who's next up?
Thank you, Armin. Thank you very much.
Derek?
And as always, we thank Executive Budish for his support in the fight against COVID. He's been with us from the beginning. He's been incredibly supportive. And it's great to have our chief elected official in the county with us and supporting us on these regular briefings. So we're very grateful to him and his staff that have been instrumental in many ways in this response. So you'll notice that when we're not speaking, we're wearing masks. And the reason is that myself, Ramona Brazil, and Dr. Gullett are in a conference room, the same conference room. And so we want to make sure that we are practicing what we preach as we do in our office every day. And so that's why we're wearing masks. We are not at home in our living rooms. We are here in the office in a conference room together. So today, if you go to our website at www.ccbh.net/coronavirus, you'll see that the web briefing for this week has been posted. And so you'll be able to find the information that we reference in the briefing today. If you go to our website, you can view it there. Today, I'll provide a general overview as I do, and I'll be followed by our Co-Director of Prevention and Wellness, Ramona Brazil, who will then be followed by our Medical Director, Dr. Heidi Gullett. I wanted to let everybody know that recently Dr. Gullett was named Family Physician of the Year here in Ohio, a great distinction, well-deserved. And so we congratulate Heidi on that distinction. And I know her peers and friends know that they couldn't think of a more deserving person this year. So currently, you know that Cuyahoga County ranking remains at red on level 3 in the governor's COVID risk rating system. Level 4 is the highest, and that's purple. As you know, we were sort of knocking on the door of purple, and so we're currently red. And it's important to know that 19 other counties now join us in that designation, which is well over half the population of the state now that would be under a mandatory public masking requirements. While we are red in terms of our ranking, we continue to very closely with our partners monitor a whole range of metrics that are used to make these determinations. We talked a bit about that last week and certainly may revisit that today in our discussions. So this week, as you'll see from our data that posted our weekly case counts, we had well over 900 cases reported this week. And those numbers have some variation as we wait for new cases to come in, classifications of different cases to be determined. And so there will always be some variation in numbers between what we report and the state reports in that process. But the trends are always all in the same general direction, and they are concerning. This is the highest number weekly total that we've had to date. We still continue to trend younger, and we'll talk about that in a moment, in this 20 to 40 age range, and that's of course concerning. And we have now tracked over 15,000 cases with contacts in 58 communities outside the city of Cleveland. It's a big number, and that continues to grow. As the executive mentioned, we have concerns about these trends and about the spreading in the community and throughout the state of Ohio. Our call center still is averaging 200 to 300 calls every day from people asking questions about masks, asking questions about testing and other related guidance, compliance with state orders, social distancing in business environments. You'll hear about our rate of positivity among our tests in the hospital systems, and that continues to increase, and that's concerning as well. With the support of Executive Budish and County Council, we continue our testing partnership with Metro Health and have been working closely as of late with the Greater Cleveland congregations to conduct testing over the last several weeks at a number of churches. And we're very happy to be part of that process, working together with Metro and the Greater Cleveland congregations with the support of Executive Leadership County Council. It's critical. Folks can get tested for free, and clearly it's a great asset for our community. The big concern with the trend in younger people is certainly that the increases in hospitalizations and ICU beds can lag, along with fatalities, a few weeks beyond when a case is reported. People can take a week or two, perhaps or longer, to become ill enough to then be admitted. And then unfortunately, they can continue to go down the wrong path, and we have fatalities as a result. So we watch that very closely and hope that we don't see that. But the concern is that that still could be in the offing going forward, big increases potentially, and we watch that closely. Those are trends that we're seeing in other states, and Ohio doesn't want to be one of those states. Younger people can unknowingly expose older folks or at-risk people that cause major complications, particularly people with chronic disease. These are risks that we don't want to have to face, because people that may be pre-symptomatic or they actually exhibit symptoms can actually transmit. People who may be completely asymptomatic can transmit. You don't know if you're in a position of transmitting, and so you have to be protective, and we'll talk a bit about that. We don't want to go the path of what we're hearing about in Arizona, for instance, or in California, now facing challenges like what New York City experienced before. Hospital surges can result in these very difficult choices that hospitals may have to make about who gets a ventilator and who doesn't. Those are choices that we don't want to face in our community. And so no one really, if you think about it, no one really wants to be in a position where they have to talk to someone, a family member, that they were positive, they are COVID positive, and they expose them without a mask. No one wants to be in that position to have to share that information. So all of us need to step up. We talked about the fact that multiple studies now indicate the protective value of masks and reduction of viral transmission by up to 75%, and with over 20 peer-reviewed articles from CDC that document the effectiveness of wearing a mask. Best practices for businesses we're finding is to post a sign indicating that masks are required upon entry. We find that sometimes people will then see the sign and pull a mask out of their pocket if they don't have it on, or they go back to their car and they grab their mask. It's really that simple. Just this morning, CDC reported that among 139 clients who were exposed to 2 symptomatic hairstylists with confirmed COVID-19, while both the stylists and the clients wore face masks, no symptomatic cases resulted from those interactions. Not one. 139 clients, 2 hairstylists, both COVID positive, everyone wearing masks, no secondary cases. That's amazing. Very powerful data. Among 67 of those clients that were tested for COVID-19, all test results were negative. This is very powerful data and further indicates the efficacy of masks that was published today on CDC's Morbidity and Mortality Weekly Report. The evidence is now in, and it is clear masks work. Masks prevent the spread of viruses like COVID-19, and most importantly, as County Executive Budish said, masks save lives. The CDC report further noted adherence to the community and company face masking covering policies mitigated the spread of COVID-19. In our communities, in our workplaces, we need to operate as if each one of us has it, and we don't want to give it to someone else. We need to protect each other. Yesterday, in support of this work, Governor DeWine announced that the Ohio Investigative Unit, a division of the Department of Public Safety, would be helping to enforce rules for mask wearing and social distancing at bars and restaurants around Ohio. We appreciate the state and local collaboration as we continue to work closely with county administration and our local communities to increase the use of masks in our community. The Ohio Investigative Unit finds a place that's not following the masking and social distancing rules, and they will, if they find a place and they're checking, they will issue a violation against the liquor permit. The owner of the establishment will then be required to go to a hearing in Columbus in front of the Ohio Liquor Control Commission. The commission will then decide whether to give the business a fine, suspension, or revocation of their liquor license. It's important to know that we, as Executive Budish noted, want to work with our communities and our business owners to comply. But if people are openly ignoring the rules, then they're going to have to face the potential for potential license being considered in front of a commission in Columbus that could potentially result in a fine, suspension, or revocation. I think that the best thing to do is to do your best to comply, and that will help to save lives on top of saving the pocketbook. Our staff at CCBH here have been working 12 hours a day for 7 days a week for many, many months since the beginning of this response. It's remarkable. I'm proud to be here and prouder every day for what public health is doing together with our partners in hospital systems throughout county government to assure that we do the best we can to protect our citizens. So with that, I'm going to move on to Ramona Brazil, who will cover the next component of our brief. Thank you.
Thank you, Terry. So as Terry discussed, the trend does continue upwards in case counts. And every week in July has brought a higher number of new cases, and this week is no exception. So last week we had over 740 new cases. This week we had over 900 new cases. So one misconception that I would like to clear up is that while people may have multiple COVID tests done, we only count an individual once. So our case count represents the people who live in our health jurisdiction and not the number of tests. So people are only counted once when they have a COVID positive test. We continue to focus our efforts on keeping up with our new cases. So this has definitely been a challenge since the beginning of July to keep up with cases. So we have an average of about 25 staff who are calling every day, and they are concentrated on calling new cases as well as contact tracing. So we continue to focus our contact tracing efforts on areas and sensitive settings like nursing homes, child cares, and group homes. And like Terry mentioned, we are operating 7 days a week and into the evening to try and keep up with new cases as they come in. We also continue to have help 3 days a week from our Case Western Reserve medical students. And this week we begun having additional help from the Ohio Department of Health through their contact tracers. It's really important to us that we reach out to people as soon as we find out about the test result. It really is the best way to get people into isolation as quickly as possible, to identify other people who may have been in contact with them and who are at risk for developing COVID-19. These efforts are all to prevent the spread and slow it down in our community. So we continue to ask those who are diagnosed with COVID-19 to inform their close contacts. Because of this increased volume, we are a little delayed in getting to contacts. So it's important to share that information as soon as you are aware that you have a positive test result. So those folks can immediately begin to quarantine themselves, and they should do that for at least 14 days from the last date of contact with someone who's been positive. We would also advise them to seek advice from a healthcare provider on whether or not they should seek out testing. As it was mentioned, we are continuing to see younger people in their 20s and 30s testing positive. The trend just continues to be the same. We see people at parties, at dinners, some from the 4th of July cookouts. We're also starting to see more travel and people who are returning sick or travel with someone who ends up being sick, and continued work exposures. So we really do ask that our community continue to be vigilant. What's going to happen over the next couple of weeks is really up to us. So it's really important that everyone kind of chips in here and wear masks, continue to do social distancing, understanding that when you do choose to get together, to have a small party, have a large party, risk is everywhere that you go. And so we're asking people to be mindful of that and to protect themselves as well as each other. And with that, I'll turn it over to Dr. Gullett.
Thank you very much, Ramona. We wanted to present you with the same kind of information we do each week, and you'll see that on our brief. but I specifically wanted to highlight our hospital utilization numbers as I have in recent weeks. And that is because a lot of people are very interested in the impact of COVID-19 in our community and specifically on our hospitals. But this is only one piece of information. It's really important that we consider all pieces of information when we consider the impact this is having and the choices that we make as individuals and as organizations, business owners, employers, et cetera. As you just heard Ramona say, we cannot stress enough that what happens in our community over the next couple weeks and the next few months has everything to do with what we do as individuals and what we do as organizations. We all can do something here. And what we're seeing is a significant increase in cases and a significant impact on our community that will continue if we don't change our course of action as individuals. We ask you to please wear masks and please socially distance. Please forego any unnecessary gatherings that really would potentially increase the number of infections. For our hospitals, we continue to see a fairly high degree of utilization, meaning a lot of medical beds that are being used on a regular basis. We don't use those in isolation from all the other information, like I said before, but we want you to understand that we have a lot of capacity here in our hospital systems locally. But that's impacted by how much spread and how sick people get with COVID-19. Specifically, our adult medical and surgical beds at this point are just around 80% utilization. And I particularly have been graphing this since the end of March when these data became available to us. And you can see those trends on our brief. Additionally, we've been presenting you data on adult critical care beds, and that has continued to increase as well. We are currently, and these are specific to the county, these are not to the region. As the county, just Cuyahoga County, we're at 80% as of this morning. Ventilator usage has been pretty stable in the mid 30s%. The highest we ever got was 55% back in April, and we haven't come anywhere near that in the interim. We did see a drop in pediatric medical bed utilization over the past week, and we really haven't seen much COVID-19 impact on the pediatric utilization at the hospital level. We have had some pediatric children admitted for pediatric COVID-19 infections, including in the ICU, but it hasn't been a significant number that has changed our capacity in our area. The other thing I wanted to highlight is the number of tests that have been done by our hospital lab partners, that being University Hospitals, Cleveland Clinic, Metro Health. These include tests that they're doing with regard to their hospitalized patients, their emergency departments, and also any ambulatory testing they're doing. We've been reporting these now for quite a few weeks, and this week we did just over 21,600 tests between the three hospital systems. That includes a percent positivity, meaning the number of tests that are positive over the total number of tests done, that is at 9%. And I've been talking about this for a while and trying to highlight that our goal would be that this would be less than 3%. And we did actually get there for a short while, but as this has increased in our community, that percent positive has gone up and up and up. And that is an average. So there are certainly some areas that folks have been tested from where it's much, much higher than that in our community. So what we know is there's a lot of spread happening. The other thing I would like to highlight, and one more thing, that does not include the labs that come from places like the commercial pharmacies and Quest and LabCorp. So those are just our three hospital systems. Finally, I'd like to highlight that our community testing program that we're so grateful to our county executive and his team and our incredible partners at Metro Health, they have given us some preliminary data that we have tested since May 14th, greater than 5,300 community members here in Cuyahoga County. Our percent positive is just under 4% for that community testing sample, although if you separate out the last few weeks, that percent positive is growing. Again, that's reflective of the larger data set that I just shared with you among all three hospitals. Of those that were tested in community settings, over 100 deployments of teams to collect these samples, and 39% of those who've been tested have identified as African American. We wanted to give you some data on different demographics of who's being tested in our community settings. We continue to remain firm that it is critically important that we bring testing into neighborhoods and into places where people trust the location and they feel comfortable being tested. This is the only way that we're going to be able to stop transmission or spread of this virus in the community. Last, I'd like to end with a moment of gratitude, as we typically do. This time I would like to highlight all of the lab personnel, particularly those in our hospital labs, who have been running 24/7 for months. They are the quiet heroes behind the lab doors who really are the ones who are giving us all of this information. Without their tireless work and their creative problem solving when we're running short of different items that are required to be tested, they're steadfast in their commitment to serving our community in this way. And so we don't see you, but we know what you're doing for us, and we thank you for that. We thank you for your leadership in that way. We know it's been a tough few months for you, and we're very grateful for all that you're doing in our collective attempt to get through COVID-19 as a community. So with that, I will turn it back over to Mary Louise for our questions.
Thanks, everybody. If there are questions, we have time to take a few. I would just ask that you identify yourself and your organization first.
Hi, this is Courtney Astolfi with Cleveland.com.
Hi, Courtney.
Oh, great. I just wanted to, I've gotten a couple notes from readers in the past couple days. These zip code maps have been pretty helpful, I think, showing folks where cases are concentrated. But because of the cumulative nature of the numbers that are being presented, I've heard from some readers that it's hard for them to tell whether there are, significant flare-ups in their areas. I mean, the range of cases have changed from week to week, and, the most hot spots seem to continue to be seen on the eastern side of the county. But again, these are cumulative numbers. I'm wondering if you can share any insights about where you're seeing these recent new cases pop up as opposed to a cumulative total over time. So folks in our community, can you give me some examples or ideas of where the current hotspots are as opposed to cumulative numbers?
I'll start off on this one. Thank you, Courtney, for your question. So first of all, the zip code map, which is now pretty standard, and this is the way when we started using the zip code map, we started at the beginning and mentioned that this is how we report influenza every year in the zip code level. So this is standard surveillance reporting that's used in public health, and it's used quite broadly here in Ohio and around the country in many places. So it's important to also note that we qualify the zip code map in that it is where a case resides. That is where a person actually lives that's positive. It does not indicate where they were exposed. They could have been exposed at work. They could have been exposed at a party across town. They could have been exposed in Texas or Florida. They could have been exposed at a restaurant or a bar, 30 miles away or in another state. So there's a bit of perhaps people feeling that something is developing or a hotspot is occurring in their community. Those are realities that we have to understand. It's also that those are cumulative cases, and a number of those folks, as we report, they recover. Basically, you have your period of time somewhere in the neighborhood for most people of probably around 2 weeks where you start to recover and are able to sort of re-enter society. That could be longer for people that have severe illness, of course, and others that are hospitalized. So we also had reported that we congregate sites like long-term care facilities, and also we see healthcare workers who are positive that are in those totals and represent a proportional amount in there that has been since the beginning been something that we need to bear in mind. So I think this idea that the zip code map means that there's a hotspot in that zip code is probably perhaps misleading for people, and that's kind of my position in terms of describing the map and some of the realities that we describe to people. There may be additional thoughts to share from our team here, and I'll pause.
I would just add, thank you, Courtney, for that question. I would just add that there are infections everywhere in our community, as in the communities adjacent to our county. So it really is incumbent upon all of us to assume that whenever we enter a space outside of our immediate home, that we'll encounter COVID-19. Everywhere you go, you are being exposed to this, which is why we strongly encourage masking when outside your home. And we really want people to understand not to be afraid of one another, but to take the appropriate precautions. Thinking of a hotspot here or there really would be a false sense of security given the widespread infections that we're seeing. And the incidence or number of new infections is very high. Now it's the highest it's ever been since this started. And that is spread throughout our entire community. So the places people get the infection and the places where people live who have the infections, again, they're often not the same place. Sometimes there is household spread, but most of the time people are getting this in a place separate from where they live. And we've got to be really vigilant and not just assume if it's not in a particular area in our neighborhood that we're safe. It's really everywhere at this point.
I would add one short additional thought, and that's CDC said near the end of June that they believe about 1 in 10 cases are actually reported. That is through a lab test. So that would show that only about, based on their calculations, a small percentage of those we're hearing about are out there and have had it or potentially are positive now. And that is why the universal approach of prevention and masks is the only way to go.
Okay, thank you.
Thank you. Is there another question?
Yeah, it's Scott Knoll from News 5. Obviously, according to the numbers, about 172 new cases this week, yet deaths remain relatively flat at about 14. Is that a sign of hope, or is that something you believe will grow as this lag gets addressed?
Thanks, Scott. This is Heidi. I will take that. And I really wouldn't read into that this is really a hopeful trend, unfortunately. I think that what you're seeing is a lag in reporting fatalities. We had a change in the way that we were tracking some of our fatalities, and we're taking fatality information from 3 or 4 different places and reconciling it on a regular basis. And what we're seeing is that there is a lag. We had some deaths reported this week who were deceased in June. And a lot of that is death certificate data. We don't get sometimes notified that someone dies until it goes actually all the way through the state system, and then they send the information back to us. So unfortunately, I think that there is just a lag in reporting deaths. And even though it is stable, I will tell you, we had 7 deaths reported this morning, which you don't see reflected in these data. So we'll go a day or two when 1 or 2 deaths are reported, and then again, a morning like this morning where we get a notification of 7 at one time. And I just want to remind everyone that, these are irreplaceable members of our community. And every time we look at these death data, it's very gut-wrenching, because this is the toll that this is having on our community. And if we're not vigilant, these numbers will be much higher. And so I would just really strongly encourage you to continue to remember these families who have lost their loved ones and who are grieving in a difficult environment where they can't hug and they can't have a normal funeral, but also to recognize that this remains a real threat to our community with regard to the number of people who've lost their lives. And that's not something that any of us take lightly.
Thanks, Dr. Gullett. We have time for one more.
I'll take it if no one else is chipping in. This is Courtney from Cleveland.com again. For weeks and weeks, you guys have hammered home the importance of preventative measures like mask wearing. Now the county has a way to kind of enforce the governor's mask mandate. I've, asked the county the past couple of days for information about how many complaints have responded to. The county's been unable to tell me that. I'm looking for an answer to that question still. And I also would like to know, between the board, the county, whomever, now that you have mass complaints and you have some data to go off of, what has enforcement looked like? Has there been any enforcement of this mask mandate beyond calling the business or municipality to let them know? Is there anything more strict than that being enforced?
I'll take that one. So first of all, thank you, Courtney. I believe we have given data, and today, as I indicated, we had 1,400 calls from people indicating that they were concerned about people not wearing masks. We've given a map of where those are focused. And as I said, it seems to be shopping malls, indoor type things, big grocery stores, big retail, and gas stations. And they're really all over the county. If you see the map, it's all over the county. We are, as those calls come in, we are giving the information over to the County Board of Health and the City of Cleveland Board of Health. Both of those have enforcement powers. And I believe that they are following up with especially the big institutions like department stores, giving them a call and urging them to make sure that the people coming in are wearing masks. We're also in the process now of beginning to call and give this information to the cities where they're located. And again, the cities also have enforcement powers. As I said at the beginning, the goal here is not to punish people. We're not looking to charge people with a crime, which is the punishment under the governor's healthcare order. We are looking to get people to wear masks. That's the goal. The goal is to make people aware that this is a constant growing problem. And if we don't fix it, we're going to see other repercussions. We've seen in other states that they've shut back down, that they've closed down businesses. We don't want to do that here. So we're strongly urging people to wear masks. But our goal is not to be putting people in jail or charging them with crimes. That has never been the goal, and that continues to not be the goal of the county.
So if a lot of that information is being passed to the board, can the board weigh in a little bit about any enforcement beyond notification that's taken place off this mask hotline?
So we have been, actually since the beginning, if we go back to March, we have a call center, as mentioned. We get 200 or 300 calls a day, sometimes as many as 500, depending on the circumstances. And so those folks are, I should pause to say that they're doing incredible work because, they have people who are often concerned. Sometimes people can be emotional about their concerns on different sides of an issue. And so they're in a very challenging situation. And people often, given the nature of what's been happening in this pandemic, the anxiety also plays out in those calls. And so I want to pause and recognize the heroic work that those folks are doing back there every day, all day, along with all of our staff. And so we have been providing data as requested on what we've been doing from the very beginning and have had multiple requests on how we respond. Some are calls that we do over the phone. Some may require in-person visits. Some may be involved with referrals to other entities, locally or otherwise. We collaborate on a regular basis with our communities. We do that across a whole range of public health programs in the 58 communities we serve. So that is not unusual or different in any way with this response. As Armin pointed out, this is not about starting with a hammer. We want to give people an opportunity to educate and comply. Our business partners are indeed that, they're partners. And so we are looking and focusing, as I said in my comments, on the places that are clearly ignoring rules. And if people are clearly ignoring the rules, then we may need to take it to the next step with all of our partners at the state, as I mentioned, at the local level here, at municipalities, and also working with our county administration. And that is our approach. So we are just, 1 week or so into this process, a little bit more. And I think that education is working. I think that we are now seeing more people beginning to wear masks than we saw before. People need to get used to this new approach, recognizing the impact it can have. And we've seen that in other states where masking has been adopted and widely adopted and also implemented by communities and people who take it to heart. So we'll continue to do that 1 week in, identify those places where we may have concerns because they are ignoring the requirement. And we find most people are trying to comply. But where we see places that clearly they're not, then we're going to make referrals and work with our partners to address those. And that's the intent. And we will do that. And those numbers are things that we've been, our overall numbers and complaints and responses, we've been reporting those since March where people requested.
Thanks, Terry.
Sure. Okay.
Thanks, everyone. If you would like a copy of the map, just shoot me an email or a text. Thanks very much. We'll let you know when there's another briefing.